this is part of the quarantine experience, so to speak. We're locked down and everybody seems to be figuring out what in the heck is going on around them in the world. And what's happening now? Are you seeing any return of any business yet in terms of Europe, or you're just having to wait out the storm?
Yes, it's indeed a very good question. So I think we are as any other company right now, and not just in eye care or healthcare. Well, depending in healthcare, but yes, it's indeed for us in eye care it's a storm because most of the practitioners are let's say not really very active right now and are mainly dealing with urgencies. So yeah, we are indeed facing a very big slowdown of activities right now, but we are well aware of that, and that's why all our efforts right now are more into, let's say, training, webinar, administration activities. We have an audit, our yearly audits coming soon, so we're allowing us to take more time to prepare those type of activities, while usually we have to deal with that on top with the sales activities.
One of the buzzwords or buzz phrases of last year was artificial intelligence, but now I'm hearing telehealth a lot. So I wonder if that's going to be the new buzzword in our industry, and certainly also integrating telehealth into the various devices.
Yes, it's a very good comment that you're making. Indeed, telehealth, diagnostic, and all those platforms in eye care, but also in other healthcare practices, are becoming more trend. And I think with this current situation globally, it's even emphasizing this type of solutions. And artificial intelligence is also something that we were hearing a lot recently, and there is definitely a lot of clinical and a lot of solutions in the market right now. I think the combination of the two can be very powerful nowadays. I think you can definitely, from a distance, gather a patient data and make already a primary care assessment based on the fundus image, or maybe in the future with AI based on the OCT image. So there is definitely a future for the combination of the two. AI combined with ophthalmic or call it the way you want, but
Right.
but there is definitely a future for those type of solutions. Yes.
I'm curious because our industry is a very tight-knit industry. It's competitive, but also collaborative. And we have seen some examples in the pharmaceutical area where competing companies have come together to try to develop a vaccine quicker. Do you think that there are opportunities in our industry now where maybe competitors need to come together different from before to advance ophthalmology in this very unique time that we are in?
Yes. I think indeed it's a very good point. I think indeed we need definitely to reinforce our link with pharmaceutical groups. We are definitely increasing and improving our technologies, and Canon is really one of those companies. We are using right now artificial intelligence and deep learning technology. We have swab source technology. So definitely we have a lot of tools in our hand today that will benefit for those clinical research when it comes to AMD pathologies or injection solution that could benefit to the patient. So I think indeed there should be a more close partnership and relationship. I think it's maybe a matter to build a kind of platform where there will be a meeting between the pharmaceutical group and the industry and sit all together. I think, as far as I know, it's not really existing today, but you are right, indeed. Such type of partnership, there is already. I know that there is already between some of the companies, but not enough, if I have to look at it. That will, at the end of the day, the outcome will always benefit to the patients.
Absolutely. And, as you've remarked before, although Canon is a big name worldwide, Canon in ophthalmology is still growing.
Yeah.
And there may be opportunities, that we're not even thinking of, that Canon can partner with other groups and provide a specialized service. Would you not agree?
Yes, you are completely right. So in eye care and in ophthalmology, Canon was in the past part of Canon Inc. group. So it was mainly, to make a kind of a very small example, it was a medical division between, let's say, printers and camera. Of course, eye care is always related to imaging at one point of time. So this is also an added value. But what happened, and that was a very smart decision from the group, is that when Canon acquired Toshiba Medical, which is now Canon Medical System Group, they have decided recently to incorporate Canon eye care division into the Canon Medical Organization. And Canon Medical Organization is really one of the big players in healthcare today. So they are leading when it comes to MRI, CT, and different type of business unit activities. So we're the latest one joining that group. And the benefit that I see is that there is definitely a lot of synergy within Canon Medical System Organization and what we're doing in ophthalmology. Canon Medical System is one of the leading company in imaging, and we can definitely benefit of some of the technology like the ACE technology, which is a deep learning technology that we can incorporate and use it also for eye care. And we can, of course, there is a lot of projects and activities here. So one of the objectives right now is really to grow Canon brand awareness in ophthalmology by leveraging Canon Medical System capabilities. Yes, and we are working hard on that.
Yes, I find that there's a lot of ironies in life and business right now. For example, there's probably no better time than now to raise awareness among ophthalmologists about new products because they're simply at home and able to practice, and they have a lot of time on their hands, so they're able to engage with material. On the other hand, because they're not working, they're probably not going to be in a very good purchasing decision or purchasing position, whether in the immediate future or when certain conferences come around. So I think a lot of companies are finding themselves in the position of having to choose whether to take advantage of this awareness period or whether to wait and see. And so far what I've seen has been essentially the smaller and medium-sized companies take a more wait-and-see approach, maybe because of cash flow issues, whereas the larger companies, which are buttressed, have strong foundations, can take advantage and make leaps ahead in this period.
Yeah, I think here definitely one of the approach will be like you may have seen is that there is a lot of webinar activities, a lot of education, and for me this is always good. Improve the knowledge of your end user about your technology, your techniques, your devices. This is for me a momentum for education purposes, and definitely they have, as you said, the time for that. So for me, higher is their knowledge about your equipment, better they can compare in the future. And the sales cycle for some of the devices is let's say a couple of months. So I rather prefer to feed our end user and our customers with informations about our equipment, how to really compare our equipments versus any other technologies, but also how to use them. We invest also a lot in education right now to our distribution channel, to our partners, our direct partners, because they are the one in front of the customer. So
Right.
higher is their knowledge, better it is at the end of the day for everybody. So we are investing a lot in education. We just finished recently a week of training. Every single day we were training an audience with a large audience of our partners on our products. And this is really helping them to have all the tools for answering the questions from ophthalmologists, optometrists, or opticians, depending on the products.
Absolutely. Well, it's a wonderful time for training, turning inward and making sure communication flows readily throughout companies. So congratulations on that aspect of the business especially.
I mean, at the end of the day, there is you need to understand that if it's, and again, this is a unique situation. So you have to be here flexible. If there is no sales activity simply because all your partners cannot visit hospital, you need to compensate that time with added value activities. And I truly believe that education and training and also preparing maybe reporting and having other discussions with your partners will benefit at the end of the day for the long run, the long-term relationship that you have with your partners, with your network, but also with the quality of service that you will deliver to the end users. So for us, it's really a lot of brainstorming and also a lot of reorganization of our way of doing business. And actually, I really like it because really in terms of quality, I can really say that the quality of service that we will provide will definitely be better. So I see that in a very, very positive way. Now, if you are telling me, of course, that this situation will last for 1 year, then it will become, of course, a challenge. Because, as you can imagine, our activities is always made of interaction, face-to-face participation to congresses,
Right.
demonstration. It's not everything can be done via Skype or any other teleconference platform. So there indeed that will become a problem for many companies in terms, of course, also of managing their P&L, costs versus revenue. So, but right now the way I see it is that there is a light at the end of the tunnel, and I think we're getting close to that situation. We just need to adjust our way of working to that moment. So we have just to prepare ourselves on how to deal with the post-COVID era. Let's put it that way.
Absolutely. Or as I like to say, there's a light in the middle of the tunnel. You just have to be optimistic enough to appreciate that.
Correct. Yes.
Well, Adele, thank you so much for joining us today here at Pi Magazine, and we wish you all the best through this coronavirus time. It sounds like Canon has a real leader in you. All the best and congratulations for sustaining during this time.
Thank you very much, Matt, for the invitation, and I'm really glad to see that you are back back to business because you went through a lot. I've been following you, and I'm really glad to be here. So thank you for giving us this opportunity to chat a little bit, and this is definitely a good approach that you are doing. I think it's very good. And I'm really looking forward to see you again in a congress very soon.